All right, go ahead, Mayor.
Thank you, Steve. Well, welcome to our 6th weekly Mayor's Breakfast. And I hope everybody's enjoying this. We have worked hard during the week to try to bring the best guests, informative guests for you to enjoy each week. We hope it's useful. We would also like to hear from you on what guests and what information you would like to hear on future broadcasts. So you can always email us at info@sanramon.ca.gov and let us know what kind of subjects or guests you would like to have on future broadcasts. You can also use that same email address, info@sanramon.ca.gov, to ask questions for the broadcast. And at the end, we will have a Q&A and we'll go over that. This morning guests, by the way, will be Joe Gorton, our city manager, Candace Anderson, our county supervisor, Ann Lachia, who is the general manager of the CEO of the San Ramon Regional Hospital, Rick Shumway, who is a CEO of Stanford Healthcare here in the Valley, and Dr. Patrick Joseph, who is a frequent guest and our resident expert on all things around the infectious diseases around COVID in particular. So thank you for joining us. I'd like to update you a little bit on things we've been doing on the city this week. One is that we developed a letter that we submitted to the other cities to get their signatures supporting or not supporting the no bail initiative that's put out by the Judicial Council here in California. We have found, and we think that the no bail criteria has been really destructive, both to our police departments and the judicial system. I know there was an article about what happened in Livermore, but it was our thoughts to let people know that there are some crimes and some instances where no bail is not appropriate, and we wanted we CC that to our other elected officials and to the Judicial Council. We also have been encouraging all health organizations, and in particular, it was great news to hear from Stanford and San Ramon Regional, encouraging all the local health organizations to resume all of their non-emergency procedures, especially mammograms and cancer screenings, things which we feel as a city are really, really important for our residents to continue and to go on. And they are doing so. In fact, they probably will talk about that. And so I really appreciate that. This week, we also had our first webinar dealt with business assistance. We know that all businesses in California, especially here in the county, are struggling. We hired Townsend and Associates, which is an organization that is very good at walking organizations and businesses through the process of trying to get aid and grants, because it can be a very daunting task to get the aid that's been set up through the state. And I want to thank Joe Gorton in particular for his initiative in starting that process. We've included and brought the Chamber of Commerce into it, so they're familiar and they're working together. So it's something we've been doing this week, and we will continue and rebroadcast that webinar for people to use. We also have been trying to encourage, and Candace probably will talk about, trying to encourage our health director here in the county to take lots of considerations into account and lots of variables into account as they make their decisions around the lockdown, and that they would also take in consideration unemployment, our businesses that are suffering, the mental health of our residents. There are lots of variables that are very, very important and should be entered into and a part of that calculus and how they want to measure and bring us back online, that there are lots of variables we hope that he will consider in particular. And the next thing is on future broadcasts, we are working hard to bring on supply chain people, because we know that's one of the concerns that a lot of us have, is how viable and robust is our supply chain, and having some people come on and talk about that. And we also have invited, would love to have the county health director come on and talk to the residents directly about the things that they're doing and some of the challenges they're experiencing. So having done a quick introduction, I'm going to turn to our city manager, Joe Gorton, for an update from his perspective.
Thank you, Mr. Mayor. Like normal, I will only take a small amount of time. I'm sure the audience is looking forward to hearing our guests. We are, as the city, we are monitoring the health order. I think the important thing to note is we have a state health order and we have a local county 6 county health order. And so as the state health order relaxes, that does not necessarily mean that we will be able to shift as quickly as the state health order may, because we're also bound by the local health order. So I would encourage those the audience to monitor the county health website. You can monitor the San Ramon, City of San Ramon website to get the most up-to-date health information for our city. We right now are transitioning to kind of the new health order that the county has put forth, and that includes some guidance on enrichment programs, some guidance on, they've opened, like allowed for the skate park, allowed for tennis, and some other activities, construction activities. So there's been quite a bit of a ramp up in some activities in San Ramon. So we're very excited about that. Now the challenge is, in a lot of ways, is for our staff to design programs that are compliant and safe within the guidelines of that health order. So that's what we're doing now. We're also preparing to bring our staff back, hopefully as soon as we can, that as soon as it's safe. So we have re-entry guidelines and procedures that we're developing for our employees. And we would encourage those folks out there in the audience that are looking to get back into the regular activity of things to be thinking about that as well. And so I'll be happy. I'll be staying around for the entire program, as you know, and I'll be happy to take any questions at the end. I'll ask Stephen Spadowski, who's our moderator. He's the deputy city manager, and if he has any anything he would like to add, and then I'll turn it back to you.
Sure, great, thank you. Briefly, please email info@sanramon.ca.gov if you have any questions. If we can't get to it today, we will make sure to get back to you. Again, you can email that website 7 days a week, and we're answering all questions related to the city, whether it's COVID or non-COVID. And I wanted to quickly share one of the website for the city. If you go to, if you go to the City of San Ramon's main webpage, on the front, there's a link to COVID-19, and we have all of the resources that we're coming across linked, whether it's city or outside with the county or with the state, on this page. And the one area that I wanted to highlight this morning is we have a virtual mayor's breakfast tab, where you can go and see the upcoming mayor's breakfasts. We have all of the previous mayor's breakfasts here linked as well with the guest speakers. And we're starting to pull clips if people want to see certain sections of the mayor's breakfast, like Dr. Joseph talking about COVID testing, or Harv Singh talking about the farmer's market from a few months back. So once again, if you go to the city's webpage, right on the front, there's a COVID-19 link, and it links to all the resources that we have.
Thank you, Steve. I'd like to turn to our county supervisor, Candace Anderson, who's been so nice to join us every morning, every Friday morning for the mayor's breakfast to give us an update. So Candace, anything interesting going on at the county?
There always is something interesting, but first I want to thank you, Mayor. I want to thank the entire city staff. You guys are doing an amazing job of getting so much very, very important information out. And to all the citizens of San Ramon, you're awesome. These are hard times, and we understand that at the county. We understand it's not just the medical impacts, but we do get the financial, the economic, the emotional impact of all of this. So just starting out by saying thank you. We're moving in the right direction, and I appreciate that. So today, or as of yesterday, we were up to 999 COVID cases in Contra Costa County. So of course, today our numbers, which are updated daily, will be over 1,000 cases. And make sure you're always headed to your city website. It has a direct link to it, but just the coronavirus.cchealth.org. San Ramon, you did not see any new cases this last week. And right now we're averaging throughout the county about 15 new cases a day, and they're not clustered in one part of the county or the other. So what that's showing is there is still community spread. It's not been wiped out. Our social distancing, what it's done, has limited us to that 15 cases a day rather than having a far, far higher number of cases. So again, thank you for what you've done to get us to this point. Now, as Joe Gorton mentioned, we're not quite ready to move into governor's phase 2. And you have to realize with these state orders, the governor is making them for the entire state of California. And those counties way up north have far, far fewer cases, far less spread than we do. And so as he makes these orders, it's for the whole state, and he's creating some guidelines by which each county can decide to opt in, or in our case, we're not quite there yet, but also we still don't have quite the level of detail the health officers would like to really be able to analyze exactly with what it means to do the drive up for businesses and other things. The nice thing that the state is starting to do is they, on their website, are starting to come up with guidelines for when you can reopen your business, what you should be planning for. And we've been doing the same on the county level, but we're sort of shifting toward looking to the state level, of course, because we want consistent guidelines, particularly in the Bay Area, where next door to San Ramon, you've got Dublin and Alameda County. So look at the state website as well as you're looking at how should we be opening. Our order that started on Monday that loosened up construction and outdoor activities like the landscapers being able to be back and working, as well as tennis and golf. Because those just started, our health officer really wants to see the impact of that. Are we going to see any spike in cases? Will we see any change in what we've been tracking? And so that's why there's not a big rush to suddenly adopt the governor's new 2.0. So we're saying we're kind of at 1.5 right now. Now, as the state moves forward, one of the main things that we've been talking about is expanded testing. And so this week we have opened up even more testing centers, including one at Bishop Ranch. And so right now we have 6 county test sites, and they are in Concord and Martinez, Pittsburgh, San Pablo, Antioch, and now in San Ramon. And we also have 3 state sites, which are run by the state that are coming on board. And those are going to be in Heather Farms in Walnut Creek, Pinole Library in Pinole, and Liberty High School in Brentwood. And you need to call for an appointment ahead of time, and that's 844-421-0804. And you can call any day of the week between 8 and 3:30 to get an appointment at our site. But given that our goal is to get up to 66,000 tests per month, we're not going to be able to just do it at county and state sites. And we really need you also approaching your providers. The county guidelines, the state guidelines are now to test asymptomatic people as well. We need that testing to really see how spread it is in the community. And so I might recommend you start with your own provider and seeing if they're able to provide you with that test, simply because otherwise you might be on hold quite a while at the county site. Now, if you go to the county site, they're not going to charge you on site, but they will bill your insurance company, if in fact you do have insurance. If you don't have insurance, you certainly would not be billed. And right now, under both federal and state orders, our insurance companies are required to cover the costs of COVID testing. So anyway, something to be thinking about, something that we need to see expanding. Right now, countywide, including public and private, we're only doing about 500 tests per day. And so we really want to expand that 4 to 5 times fold, so quite a bit more. Testing, we're continuing to expand our testing, asymptomatic testing in congregate care facilities. That would be some of our larger senior care facilities, as well as the jail. And you may have heard earlier this week, we did have our first case in the jail. We do have a protocol in place so that if anyone is booked, and as I've said before, yes, our booking is limited. It's a concern to the sheriff. He would like to see expanded as well. But what we do is we put them in a quarantine pod for the first 14 days to see if there are any symptoms manifest. Through a proactive pre-testing within that quarantine pod, we identified one of our inmates who in fact was positive. And that was just a preemptive testing. He wasn't showing symptoms. And so he has since been isolated. Now, yesterday, we had a second case. This was an unusual one. This is where someone was being booked into the jail. Rightfully so. It was a domestic violence situation. And as he was booked, he announced that his victim had tested recently positive for COVID-19. He was immediately then tested, and he was also identified as being COVID positive. He's staying in the jail, but also being isolated from the rest of the jail population. And so we're really focusing on that. We're also really focusing on being ready to open up more doors with our economic recovery. Supervisor Mitchoff and I had our first ad hoc advisory committee on COVID impacts yesterday. Mostly we were listening to a lot of concerns, of course, and a lot of businesses telling us sort of their specifics, their challenges, the ways they thought they could open up. And so at our next meeting, which is this coming Thursday, next Thursday at 1:30 p.m. You're available it's available for you to attend on Zoom. We're going to be talking first about personal services, and that can be personal services in the home, such as your cleaning lady, cleaning services coming in. It might be your piano tuner coming in. And then we're also going to be talking about recreation lifestyle services. And on our call yesterday, we did have Michelle Lacey, who was formerly with the town of Danville, formerly with the city of Orinda, and then Pleasant Hill Parks and Rec District picked her up, but she said she is sort of leading a coalition of other park directors throughout the county of some of the guidelines that they want to see in place as we look at how we do summer camps, summer activities, things of this nature, because in the new order, you are allowed to provide classes and activities for groups of children 12 and groups of 12 or fewer. And so it can be any age up till age 18 that you can provide these classes. And it's supposed to be provided to children whose parents are allowed to work. And there's been a lot of people looking at the FAQs and say, well, what does that mean? Do you have to be an essential worker? No, you could be anyone who is allowed to go back to work, including working from home. We recognize that in order for parents to work from home, they can't just plop their child in front of a television or in front of their screen and hope they have a good day. We want to see enrichment type activities. And so that's why we're really coming up with these FAQs so that if you do them properly and you sort of look at the child care guidelines, they can be done safely. With the primary objective is you've got same group of 12 kids who are together in that class, in their camp, the same instructor, and that group of kids is socially distanced from other groups of kids, and they're not using shared equipment, shared resources, but they're socially distanced. And that's one way we're moving back to a little bit more normal. And so people keep saying, okay, so how are we really opening up? And we do have these 5 indicators that our health officer has talked about. The nice thing is on the county health website this week, we're finally starting to track these indicators. We're providing you a dashboard of how are we doing. And so the first indicator is the total number of cases in the community is flat or decreasing, and the number of hospitalized patients with COVID-19 is flat or decreasing. And so certainly we're not completely flat or decreasing in the number of cases, but we do see the number of hospitalized patients, which is a far more relevant number, is flat or in fact decreasing. Next is that we have sufficient hospital capacity to meet the needs of our residents. We continue to have that, and we're tracking that with our ICU beds, we're tracking that with our respirators, and we're well below occupying 50% of those beds, which again is a very, very positive number. Next, that we have sufficient COVID-19 viral detection, which is that fun nose swab, are being conducted each day. And that's where we need the community coming forward, requesting those tests, whether you're symptomatic or not. You know, ideally, we want to give priority to anyone experiencing symptoms, but we want people being tested. And then that we have sufficient case investigation, the contact tracing, isolation, quarantine capacity. And that's what we've really been able to build upon in our county. As I mentioned before, we are hiring more, we're training more. The state has on its has a training that we are able to enroll each of our new hires in this area to immediately get trained. It's a weekly course, and so we're continuing to hire more as we're seeing some of our library staff that, because libraries are closing down some of their hours, librarians are some of the best trackers and tracers. They're great with tracking down books. They're going to be quite a few of our librarians are going to be shifting over into, or library personnel, not the librarians themselves, but the personnel may be shifting into this role as well. And so we're seeing some very, very positive things. And then the final one that we're really looking at, and I would say with that tracking, what they're really looking for is at least 90% of the cases they can identify their contacts, who they've been in contact with, and that we can have 90% of those who are identified safely isolate as well. And we do have our overflow capacity both at Craneway as well as the fairgrounds not being utilized yet, but those are facilities where someone could be isolated if they're not able to be isolated within their home. And so we really want to move forward. It's really our testing and our tracking are those the very strong things that we're working on. And then it's making sure that we have this 30-day supply of personal protective equipment, the PPE, available to our healthcare providers. And right now, according to our Emergency Operations Center, gloves are not an issue. You can order gloves pretty easily. They're in the supply chain. Other personal equipment still is not in ready supply. We do have quite a few requests coming into the EOC from medical providers, from dentists, others who are still not able to access that equipment through their supply chain. But we're now going to be tracking on a weekly basis, sort of a questionnaire. Do you have a 30-day supply of PPE? And I'm looking forward to hear from our representatives from medical providers. I know we've got Rick on the phone right now, and we've got Ann. I'm really looking forward to see how quickly our hospitals and our healthcare systems, how they feel they are with PPE, because that is a big issue. And talking about our EOC, we're starting to look at how we're going to ramp down the EOC. It'll still be operating, but on a lower level, because we're also starting to gear up for fire season and the potential of, PSPSs, the power shutoffs, things of this nature, earthquakes, what other calamities come our way. Hopefully not the locusts, but we're hoping, and I'm saying that facetiously, there are no locusts coming, but we sort of feel like we're in biblical times being hit by plagues and other adversity. So we're ready for those as well. That's the beauty of having our emergency operation plans in place, and especially in the San Ramon Valley. Shout out to our Citizen Core Council, which is made up of the city of San Ramon, the town of Danville, the school district, the fire district, the county, where we're meeting quarterly to ensure we are ready for any disaster that hits our community. So that is the end of my report for today. And later on, when you're ready, I'm happy to answer any questions you might have.
Thank you, Supervisor Anderson. I'd like to turn to Ann, who is the CEO of the San Ramon Regional Hospital, to give us an update. Ann was a guest about 3 or 4 weeks ago. And so how are things going to the hospital, Ann?
Yes, thank you, Mayor Clarkson. I first want to say thank you again to the city and to the county. You all have been amazing partners, and we really appreciate the constant communication and collaboration. It has been very, very helpful. So my goal is to provide a quick update on how we're doing with coronavirus in San Ramon, and also to encourage our community to have confidence that you can get healthcare if you have other issues, not just the virus. I think that what we're finding is to respond to this very real and very serious public health crisis, we have potentially have people who are afraid to get care for other health issues, and that is also a concern and can be a public health issue as well. And so now that we're preparing for sort of this easing, and as we're much more in control and aware of our situation as a health system across the whole Bay Area and the whole state, we want to make sure people are confident and comfortable getting other healthcare needs taken care of. So first, a quick update on coronavirus. We certainly have capacity, as Supervisor Anderson mentioned. Really, the hospitalizations have been gradually ticking down and looking pretty good. We certainly have a strong supply of PPE, fortunately. So I know that all the hospitals in the Bay Area are going to be asked, like she mentioned, about the 30 days on hand for PPE. And that is certainly something we are comfortable with and we have on hand right now. So we feel much better about our supply chain. We continue to have very strong infection control processes in place. We have had no known cases of transmission between patients and staff or vice versa. So we feel very very good about our position. We haven't been overwhelmed with the number of cases at all, and it's been very manageable. In addition to just looking in our four walls at the hospital, we've also done a lot of outreach. So for example, there are a lot of post-acute providers or nursing homes in the area, and that's where in other areas of the county and around the country, there have been outbreaks. And so we've done some outreach to the ones that we work with the most locally to make sure that they feel supported, to give them some advice and some guidance on how we do infection control in case it can help them as well, and really trying to be an extra layer of support for them so that there are no outbreaks in their facilities, so then those patients don't end up coming to the hospital either. And so far that seems to have been very good, and the local providers are very strong in what they do with infection control from what we can see. So we have felt good about how that's worked out so far. Of course, it's a very vulnerable population there, so we want to make sure to look out for them. I know that the county health officers have also been much more focused on the skilled nursing facilities and nursing homes to make sure that they have the resources and support that they need to be ready for potential outbreaks and to hopefully prevent them. I would add to what Supervisor Anderson mentioned. So certainly testing is available in Bishop Ranch now for county residents. A few weeks ago, we opened up our testing facility on site at the hospital for outpatient testing. It's a drive-through testing arrangement. And I believe that the county testing site in Bishop Ranch is specifically for county residents. So I want to clarify that at the hospital, you can be from a different county. I know we're right on the border with Alameda County. So Alameda residents are also able to get tested, or any county is able to get tested as long as they have a physician order when they're coming to the hospital. So if for some reason you run into difficulties getting tested because you're not a county resident, there are other options. I know Rick will also talk about a testing site to the south as well. So there are more places than ever to get tested. And certainly that's a big push and a big thing we want to encourage. Dr. Joseph and I talk regularly, pretty much we email almost hourly because he's our medical director of infection prevention at the hospital. And he has been saying this from day one, is that testing is crucial, because until we know how the population as a whole looks, we won't be able to take that next step of fully reopening. And so we're doing our part to make sure testing is available on an outpatient basis for the community as long as a physician orders it. The other thing I wanted to share on is now it is safe to get care. And so back on the 22nd of April, Governor Newsom made some remarks about how it's now time to really start doing scheduled surgeries again, scheduled cases. These are things that, you know, you don't show up at the emergency room and need surgery within 10 minutes, but they are things that you really shouldn't be deferring for days or weeks or months, because they will become much more serious chronic issues.
Yes.
Surgery, for example, or plenty of other cases where, you know, if you don't get care within a timely manner, it will become worse. So he stated on the 22nd that it is now safe to start doing those types of cases. The California Department of Public Health quickly after issued guidance on the steps we need to take in order to resume normal procedures and surgeries. So we have been following all of those guidances, all those steps. And so as of May 4th, we have started doing our regular scheduled surgeries and procedures in the hospital. Governor Newsom did specifically state plastic surgery, cosmetic surgery should not continue at this point. So we are not doing those, but all of the other traditional surgical cases that are medically appropriate, we have continued, or we have resumed as of May 4th. We are taking a lot of steps to make sure that those patients are protected and are safe. We recommend that patients get tested before surgery. Ideally many days beforehand, so that we know well in advance what the patient's status is. And we do give guidance to patients to self-isolate before surgery for a number of days, so that way they aren't exposed to any risks or any potential contagion in the days leading up to the surgery. And that enables us to give them extra security and guidance. But there also are a lot of preventative measures that we take with using N95 masks and appropriate PPE to make sure that we are protecting our staff and our patients when they do get any surgical procedure at the hospital. And at our hospital, we'll accept test results, not just from our own testing site, but also if they get tested at the county or anywhere else, they can provide those results, and those are helpful. So that's really a recommendation. Certainly, if a patient needs emergency care, we want to also encourage people to still come to the emergency room. Our medical director of the emergency room has been sharing broadly how important it is to seek medical care in an emergency. One example he gave was a patient who had ruptured appendix, and the patient had started feeling symptoms several days before, but was afraid to get care because right now no one wants to go to the emergency room. And I think that if they had gotten care earlier, maybe it wouldn't have actually burst. And so, and I'm not a medical doctor, so I don't want to speculate on that. But in general, if there is a true medical emergency, it's important to get care at that moment, not to wait. Really, the hospital is a very safe place to be, not just San Ramon, any hospital. It's very important for people to feel comfortable. And the number of precautions that we take to screen all of our patients, to screen our staff and make sure that our staff are not transmitting it to anyone as well. That's very, it builds confidence, and it's something that I want to make sure everyone feels safe to get care. The last thing I want to mention is, as you may have seen on all the social media and all the news, this is National Nurses Week. And so I'd like to give our nurses and all of the nurses across the country a huge shout out and compliment for their amazing dedication to a really noble profession. The week is May 6th to May 12th. It's always celebrated around the birthday of Florence Nightingale, who's obviously one of the founders of the nursing profession and a very important nurse in our history. Her birthday's on May 12th, and she really created modern nursing. And 2020 is actually the 200th anniversary or birthday for Florence Nightingale. So this is really, this has been declared the Year of the Nurse, and we're very grateful for the thousands and hundreds of thousands of nurses across the country who've been at the front line of this pandemic, and they are truly to be honored and respected, and we're very grateful for them. I'll also mention that National Hospital Week is the following week, May 10th through 16th, and then the week after that is National EMS Week, May 17th through 23rd. So really May is the month of healthcare every year, but certainly this year it couldn't be more timely, and we really are proud to celebrate all the caregivers at every location across the country who've really stepped up in this situation. And I'd also like to thank Dr. Joseph publicly, because he has been a tremendous help and resource to our hospital as well as to the city. And we're so lucky, yes, one of his caliber and expertise providing guidance on these important issues. So I'll wrap it up with that. Thank you.
And thank you very much. And just sort of reinforce to encourage people to get their regular mammograms, get their regular cancer screening. Don't delay, don't put that off. These are not elective sort of things. These are things that people need to be continuing and doing. There's a backlog because of the discontinuation for a while, which is really a shame. So I'll say it'll be a question for Rich too, but you would encourage people to continue and get that going, right?
Absolutely, yes. Colonoscopies,
yes,
ammos, all of these are really crucial. I have personal experience because I've had a family member getting healthcare in the hospital in the last month during this time period, because I encourage them to get care. It's so important to not disregard all the other things that happen within one's life that need to be addressed, and preventative care is so important. Even a couple of months can make a big difference when it comes to
absolutely
cancer. So please don't put those off. Those are very important.
Thank you, Anne. Also, I assume I'll be missing the annual Florence Nightingale little luncheon you guys have, and you give awards to nurses. Maybe you should Zoom that this year. We can still say thank you to those great nurses.
Yeah, actually, it's a good point. Usually we do big gatherings, and since we're social distancing, we've really cut down on our big group meetings right now, but we are doing a lot of virtual celebrations and small group things. And so we'll definitely include you. Thank you for that.
We'd love to say thank you to all their work. Okay.
I appreciate it. Thank you.
Sure. Hey, Rich, welcome on board. You got a great summary from Ann as to what's going on. Fill us in on Stanford Healthcare here.
Yeah, thank you very much. I do have to say, Supervisor Anderson, there may not be locusts, but there are murder hornets that are coming. So that's something we may have to keep an eye out for. Thanks. And I will just say amen to what Ann shared, and hopefully try and be as succinct and non-redundant as I can. I'm going to try and share my screen briefly. So tell me if you can see this. Just 1 second. All right, are you able to see my presentation? Can you see that?
Yes, we do.
Perfect. So I'm just going to run through just a couple of quick things, again, mostly just in support of what Ann is talking about. And certainly speaking from a healthcare industry perspective, obviously doing this through a Stanford lens, but want to make sure that you're aware of what else is available in your community. And I think I've had an opportunity to speak to this group before around some of the testing things. And so for me, it's really about today hammering home this message that it's time to resume care. It's been a really interesting, dynamic time for all of us, a lot of uncertainty, but I think what you're starting to hear from healthcare organizations, healthcare experts, healthcare leaders, is we are now in a position to be able to start back where we left off. It's a new world. We're certainly having to change many of our protocols and different things, but we are in a position to be able to take care of you for whatever it is that you need to be taken care of. And I think, as Anne said, all of us are absolutely focusing on making sure we're following the guidelines that are out there. We follow the Centers for Medicare and Medicaid Services, which is the national governing body, regulatory body for all of healthcare. They've put out a lot of recommendations. Certainly the governor's office, certainly the state public health department, our local and regional public health authorities and otherwise. And so the decisions that we're making related to restarting really are based on the best evidence by all of the experts that exist. And again, I'll just reiterate, we are seeing, and I will use the word significant patient care issues because people are choosing to delay necessary care. And what I continue to remind people is that the county orders themselves are actually very broadly exclusionary of all healthcare. So even when the shelter in place went into effect almost 2 months ago now, it was very clear in that shelter in place order that if you needed healthcare, you could still get it. But I think that for a lot of reasons, people have chosen to delay a lot of those things. But in the end, you think about, again, even the elective things, the example I use is you may be waiting for knee surgery. You might be on opioids right now. We don't want you on those opioids for an extended period of time. So the longer that you delay that, the worse off a potential clinical outcome could be. The other message that I want to say very strongly is that our local and our regional hospitals are not overrun with high volumes of COVID-19 patients, and we're not overrun with other patients right now. And I think this is something that I can broadly say for all of my colleagues in the Bay Area healthcare industry. We did not see a New York type of an experience. So many people perceive that the hospitals are these hotbeds of significant numbers of COVID patients. And the answer is that that's not true. So we certainly are managing that disease within our construct. But I want you to know that the hospitals are in a position to receive patients that are non-COVID patients. And I have to say, the word I use is, I actually believe that hospitals are some of the most prepared environments to manage this infection. You're probably safer in a hospital than you are going to Safeway. So I think that that's one of the things that I would strongly suggest that you consider as you're making decisions about returning to the hospitals for care. So let me tell you just a few things that we're doing to ensure that when you do come here, that you're safe. And again, many of these things, many organizations are doing. Some of these things we're doing at Stanford, but we're screening and we're testing all of our patients as they come into the hospital. As Anne said, whether you're an inpatient, whether you're coming in for surgery, we're making sure that we understand your clinical base related to COVID-19 before you come in. We're masking all of our patients and all of our healthcare workers. I think that's an important distinction as well. We're also symptom screening all individuals entering the hospital. If you walk into any of the main entry points, you're going to have a symptom screen, including a temperature check and a questionnaire and all of those things to make sure that we know before you move on to the next phase if you're symptomatic. And if you are, then we'll have a different conversation. All hospitals are under continued revised visitation policies. While we love to have people in our hospitals supporting our patients, at this time, to reduce community exposure, to healthcare workers and to patients, most hospitals are very restricted related to being able to enter them if you're not a patient. So we're continuing that as we revamp the elective work that needs to come back online. We're using telehealth, we're using virtual check-ins, remote monitoring to limit that exposure, to patients and healthcare workers. We're also, when we decide to do surgery, we're actually making that decision also based on where you're going to end up after that surgery. If you're going to need to go to a skilled nursing facility, we might make a different decision to ensure that we're not overburdening those environments. So we're making those decisions as well. We're co-locating COVID-19 patients within our hospital so that we can manage them very tightly. We're increasing the testing to all of our healthcare workers. So we actually test all our healthcare workers with both the nasal swab that you hear about, but at Stanford, we're also doing the antibody testing for all of our healthcare workers. We continue to symptom screen our healthcare workers. They have to check in every day. These are county and CMS guidelines. And I will suggest the same thing that Ann did. We are doing well with PPE. We feel very comfortable with our ability to restart these procedures given the PPE levels that we have. We're monitoring the disease in the community every single day, just like all of you are. And if the conditions change, we're able to pivot and we're able to change quickly. We've certainly enhanced our disinfection protocols. And then the last thing that I'll share with you here at Stanford Healthcare Valley Care is we are actually engaged in many clinical trials for the treatment of COVID-19 patients. In fact, the remdesivir news that you may have seen this week, that the FDA approved the use of remdesivir for treatment of COVID-19 patients, was actually trialed here at Stanford Healthcare Valley Care. We were one of 54 sites in the world that actually participated in that NIH trial. And we've actually started working on launching 4 to 5 additional trials for the treatment of COVID-19 patients. So we're able to do that here. We have the infrastructure. And so again, that's an important point to note related to the safety and returning back. So I think I just will close again with the same plea. We are designed to adapt. This is what healthcare does. We change with changing conditions. And so we are absolutely ready for your emergency, for your elective procedures, for your screening procedures, all of those things. So we're asking you to come back and to get the care that is so needed so that we can make sure that we're not exacerbating what's already a challenging problem and making sure that we're providing those services as we go forward. So I'm going to stop there and turn it back over to the mayor.
Thank you, Rich, very much. Great update. Dr. Joseph, thank you for returning. We know that you have a very, very busy schedule, and we so appreciate what you do for informing the residents and also helping Ann and Rich in their businesses. You're sort of everywhere. So this is sort of open to you to share with us your thoughts about things that you think residents should know about this week and going forward.
Well, thank you, Mr. Mayor. And as always, thank you for the invitation and thank everyone for the nice compliments. They're always nice to hear. The compliments really should go both ways. I've had the opportunity to work with multiple epidemics, including HIV disease and SARS and MERS and Zika and Ebola. And I have never seen a community that is so well informed, so much behind the science. And I can't walk down the street or into a hospital or into an office without somebody being quite knowledgeable. So congratulations to the whole community for caring and being involved. I picked 2 or 3 things to discuss quickly, but I want to follow up, as I usually do, on introductions made by Supervisor Anderson. Early this morning on a conference call, I heard the term that the way we are reopening is trial and error. And I don't like that term. I think that is misrepresentation of what we are doing. What we're really doing is an old, tried and true epidemiologic principle. That's, you measure a baseline, you make a defined change and remeasure. That's what is going on right now. The defined change is from the county health officer. The remeasurements are the indicators that were mentioned by Supervisor Anderson. And I will only comment on one that is new, and that is the case investigation. What that means is as we reopen, any individual who gets COVID-19 will be thoroughly evaluated to see where they got it. Was it family, contacts? Was it because of the businesses we opened? And I won't mention any, but if there is one particular business that opened that turns out to be more risky than predicted, that has to be evaluated. So it's a very, very well-defined epidemiologic principle. And so far we've used two. We've used quarantine, which is absolutely known to everyone in our community. And now it's the measure, make a change and remeasure. So I thought I'd mention real briefly a couple of things that have happened in the past few weeks. When COVID-19 was started, all of us knew the symptoms of COVID-19 that were being promoted: fever, cough, shortness of breath. There has been an expansion of those because we have learned so much more that some people who have COVID-19 don't have any of those three. They don't have a fever, they don't have a cough, and they don't have shortness of breath. So the new ones for which people should be aware are chills, muscle aches and pains, a sore throat, which would completely surprise many of us in the field of medicine, but just a sore throat, like a strep throat, can be a presentation of COVID. And here's the one that I think is not well known: an unexplained loss of the ability to smell and an unexplained ability of not able to taste food. And it can be only that. The classic way to test smell is to smell fresh coffee. It has a very powerful effect. I'm not talking about brewed coffee, but coffee grounds or ground coffee before it's brewed. Very powerful effect on that particular part of the brain. And if an individual used to be able to smell coffee and now cannot smell coffee, that is a sign to contact your doctor. And similarly, if someone loves the taste of a particular food or drink and now can't taste it, or it tastes funny, that also is another one. The next quick topic is we are learning about the infectivity or contagiousness of COVID compared to other diseases. So before social distancing protocols were enacted in our area, that is when we were going out to retail businesses, going to supermarkets and carrying on activity without masks and without a 6-foot social distancing parameter, the infection rate was about 2 to 3. In other words, for every person who had COVID-19, he or she would spread it to 2 or 3 other persons. So that's a doubling. That means for every person, there's 2 or 3 more. And the numbers I'm giving you are representative of a population density where we live. Areas that are extremely population dense, such as Manhattan, the number is much higher, only because the contact is much greater. So the social distancing that we have done is based on that, and that shows up in the doubling time, and it has been effective. Now, to compare that, flu in the height of flu season is about half of that. So an individual with influenza typically only infects 1 or 2 others. So this is more infectious or more contagious than flu. And before social distancing, the doubling numbers could be explained by that principle. And the last thing is, and I don't think I've talked about that here, is convalescent plasma therapy. This is another old principle for infectious diseases for which we have no therapy. And very simply, it's giving a component of blood from a person who has recovered from a disease to someone who is very sick. Or in other words, giving a component of blood from someone who has recovered from COVID-19 to a person who is sick in the hospital and struggling to survive. This used to be called serum therapy, and it goes all the way back to diphtheria, for which a Nobel Prize was given. So it is tried and true, and it works, and it is commonly used until more effective therapies like remdesivir or other drugs that are being studied. take the place of serum therapy. It's not completely effective, but when you have very little to work with, it's a major component. And we are using it. It's available in every hospital in the Bay Area. It is a protocol through the Mayo Clinic and through the American Red Cross. And I encourage anyone who has recovered from COVID-19 to consider contacting the Red Cross, describing the fact that you have recovered from COVID-19 and you would like to donate to help another who may be seriously ill. And with that, Mr. Mayor, I'll stop, and we usually have a few questions.
We do. And Steve, I'll go back to you, Steve. Questions for our guests?
Sure. The first question is, given the governor's directives this week, are businesses that adopt strict social distancing and sanitation protocols now welcome to reopen? Are there any city or county conditions or certifications that are necessary to reopen?
Candace, I'll let you start with that one.
Yeah, and the reality is that you still need to follow the county guidelines. Go to the county website, look at our FAQs. We are watching with great interest as the governor rolls these out. But as I mentioned, he is rolling out orders for the entire state. And we're way up north near the Oregon border and inland. They have very few cases. They're ready to move into that phase 2. We're not quite there in Contra Costa County. We want to see the impact of the loosening we had this week. But hopefully we're not going to be far behind. When we see those guidelines, maybe we'll be able to do some of those drive-up businesses. Meantime, businesses do start getting prepared. We can guarantee you that through the fall, if we do open up every single business, there's going to be you're going to have social distancing. You may need plexiglass to protect your sales clerks. You're going to need to have ways that your customers can be safely in a store. So start looking at those. The state website is coming up with some guidelines for how you can safely do that with businesses. We have some of that also on our county website. But for now, you're stuck with our county guidelines until our county health officers in the Bay Area, who continue to want to have the same orders in effect for all of us, because we have such a shared economy, shared transportation. We're in one county versus the other. We're not ready to roll out phase 2 yet.
And as a follow-up question, when do we expect the full opening of the economy?
That's where I'm going to send you back to those indicators. And so go to our CC Health, coronavirus, cchealth.org, look at the indicators, and there's a whole dashboard on the indicators. And that's what they're relying upon. As I always say, my crystal ball is still very foggy as to when we're going to be at that point. But once we reach the point where, in fact, we can meet all of those indicators, we're seeing that flattening that we've already seen, but either declining in cases, and we're seeing that we have sufficient PPE. We're seeing this ability to not only respond to the disaster, but really to be able to meet that testing and that case investigation. That's what's so critical to avoid another surge when we open things up. And that's where you look to how it's been done in other countries. You know, if you're traveling in Hong Kong, and I always relate my friend who lives and works in Hong Kong, you know, they're still wearing masks. And when they go into store, their temperature is taken. And the moment someone is identified as being COVID positive, they're immediately isolated. We have to have that tracking, tracing ability in place before we're at a new norm. And then really, you know, when we're really going to have the go back to the old days, it's when we have a vaccine. And that's just the reality. But in the meantime, yes, we want to get things open. Yes, we want all of our small businesses operating, and we just need to make sure we can do it safely.
Candace, I think it'd be, from my point of view, very helpful if we could get the health director to come to the mayor's breakfast and allow him to spend some time talking
yes,
from his point of view and his ground rules. That'd be really helpful if you could encourage him to join us and share with the residents so they could hear directly from him.
I would be delighted to do that. And I know my chief of staff has been talking with you about that, Bill. And I know we're going to get Dr. Farnatano for one of our future meetings. So thank you.
Great. Thank you.
So, Mr. Mayor, just as a point of clarification too, because we do get these from residents occasionally, the city has no rules that are more restrictive than what the county health officer has implemented. So we are going off, the city itself is going off the county health officer's orders. So if there is a question, it's really up to the county health officer to determine what course of action, and not the city.
Thank you, Joe, for that clarification. Steve.
We also received questions about when can we expect the dog parks to reopen and the public pools, but I think that's been addressed already through the comments. Another question is, I heard that COVID may be mutating. What does that mean?
Dr. Joseph, that might be up your alley.
Yes. Well, viruses always mutate. So the COVID virus is an RNA virus, so it has several different base pairs, about 40,000. And as the virus replicates, there's often typographical errors. So every son of a parent virus is not the same as the parent. That's a mutation. It's just a change in the genome or a change in a gene. Happens every time a virus multiplies, and there may be tens of thousands of mutations. The ones that are of concern are mutations that may make it more infectious, more contagious, or more resistant to therapy, such as remdesivir. That has not occurred yet. What we can tell about the mutations, that is the stable mutations of the virus, is where they came from. So in our area and on the West Coast, the viruses that we have a particular genetic sequence that can be traced to China. The viruses that are in the East Coast and in New York City particularly can be traced to Europe. So those are mutations. Now that we can measure mutations so easily in a laboratory, we're always looking for mutations that may confer greater infectivity or greater seriousness, but so far that has not occurred.
Great, thank you. That's reassuring. Steve.
All right, next question. Do local hospitals still need PPE donations? And also, what else can residents do to support healthcare professionals?
And I'll start with you, then I'll go to Rick.
I'm happy to say we finally have, a very good and stable supply of PPE. So I think there are a lot of other organizations that would benefit from PPE donations, and certainly I would, encourage you to reach out to those. It could be post-acute providers or all the other facilities that are out there and senior facilities, but our hospital in particular doesn't need PPE at this time. But certainly we've been really touched by the number of people who've reached out to bring, food. A lot of local restaurants have provided pizza and ice cream and catering, and that's certainly welcome and something that really cheers our staff and makes everyone feel so much more encouraged and supported. We've also had a lot of people, provide banners and signs. The Rotary Club, the local high schools, they've sent videos and all sorts of just well wishes through different channels. And so we certainly appreciate that and welcome that, especially with Nursing Week and Hospital Week around the corner. So if anyone is interested in doing any of that, we certainly encourage that. And if you call our phone number, our main line is 925-275-9200. You can reach our administration, ask for administration, and we'd be happy to connect with you to arrange for any sort of displays or anything like that. So that's what I would say. And the most important thing is always for now is stay home if you don't have a need to go out, so that we can continue preventing the spread. And then go to the hospital if you need care, because that's important too. And our hospitals, all of our nurses and everyone, we want to be here serving you. And so the way you can support us is by getting the care you need when you need it.
Thank you, Ann. Rich.
Ditto. I think that's about right. I think that it's just continuing to show support for people that are in the midst of this on the very front lines, and as Ann said, I think that the appreciation for that with all of these mechanisms goes farther than our nurses, our doctors, our radiology techs, our environmental services staff, everybody. Are having to internalize this just like you are. And so I think that making sure that that they have an opportunity to be recognized in a variety of different ways really goes a long way. You'd be surprised what a poster on the front of the hospital does. So thank you for your support, and we'll continue to support all of those same mechanisms.
Well, but can I just add, we are still collecting PPE that is distributed through our Emergency Operations Center. And where we get collections and donations, it's often going to small skilled nursing facilities or congregate care facilities, you know, those 6-person homes where they may not have the PPE. So we still do have a demand for it. And so please feel free to go to the county website. We do have donation links. And if you happen to have PPE lying around that you're not using, by all means, there are groups who really could benefit from it. But it's a great relief to know that our hospitals have the supply chain completely filled, because that was one of our more critical concerns early on in this crisis. So good news there.
Thank you, Candace. Steve, we have a question or two more to go.
Sure. How about this one is, how effective is hydroxychloroquine as a therapy?
Dr. Joseph.
Yes, hydroxychloroquine or Plaquenil was initially thought to be an effective therapeutic option. And this was based on observational studies. Observational studies are the scientific term for something that is uncontrolled, just a doctor's opinion or a healthcare worker's opinion, and that's observational. Anytime an observational study suggests that a drug is good, it needs to be studied in greater detail, that is compared to other drugs or compared to other standards. And so hydroxychloroquine, also known as Plaquenil, initially looked very good. Unfortunately for all of us, when it was compared to a placebo, it was no better. And as a matter of fact, some of the side effects of hydroxychloroquine became more manifest and easily recognized. So at least as of today, hydroxychloroquine is not part of the recommended therapy for either treatment or prevention of the coronavirus.
Great. Steve, got one good last question for us?
Sure. How often should I be tested for COVID-19?
Dr. Joseph, I'm going to toss them back to you again.
Well, I heard yesterday, let's assume the testing is the PCR testing for the presence of the virus in the nose and throat. And I heard yesterday that the president and his close contacts are being tested daily. That might be a little bit in excess for most community members, yet I understand how important it is to him with his contacts. The answer is completely unknown. What we said last week, or the last time I believe we discussed this, is that if I am tested today and I am negative, I am only negative today. I could be exposed tomorrow. So there's not a frequency, but rather a situational description for testing. If I get tested, there should be a reason. Either I think I have been exposed, I know I have been exposed, or I have symptoms. And that could be once weekly. If I think I'm exposed once weekly because of my profession, then that would be appropriate. For an individual who is in a household that is efficiently quarantined and maintaining social distancing, it may not be necessary to be tested at all. So the bottom line answer, it is situationally dependent based on exposure, on symptoms and risk.
And I'm just going to add, because actually Dr. Frantantano was asked this question yesterday at our press conference when we were promoting testing. He said the one area where he would recommend more frequent testing would be someone who regularly works with a vulnerable population. And there he thought even once a month would be sufficient, you know, of course, unless you're manifesting symptoms. So I think it goes to who are you going to be in contact with as well.
Good. Dr. Joseph, I have kind of my own question in terms of, as you look at trends and things that are going on right now, the last few weeks, do you see any patterns occurring? Do you see us going in a particular direction, or is it still unclear in your point of view?
Unclear. Definitely better than it was a month ago. Still having the same number of new cases per day, but there's always a lag in that. I think this has to be taken in context of multiple variables. So if we have the same number of new positive tests, but we're doing more testing, that is suggestive that we're going the right direction. We are definitely not going the worst direction, and that's the best news. So this is not just a moving target. This is a freight train going downhill uncontrolled. Everything is moving so quickly, but no warning signs. And I think Supervisor Anderson wrapped that up so perfectly. No warning signs. And as we gather more information, I think we're going to be looking pretty good in our community.
Great. Well, thank you to all the guests, Ann from San Ramon Regional, Richard from Stanford Healthcare, of course, our supervisor, Candace Anderson, thank you. And Dr. Joseph, appreciate your insights and your wisdom always. And Joe and Steve, thank you from the city for being here and making this available to our residents. Remember, residents, you can please email us at info@sanramon.ca.gov with your questions. And also, more importantly, who would you like to be a guest here, or who would you like to continue to be guests and come back on, and what are your questions for them? So thank you so much. I think this wraps it up. Thank you. Have a safe weekend. Thank you to everybody. Take care.
Bye.
Bye-bye.